Hello, everyone. Welcome back to the show. Now, we often think about health in terms of what we eat, how we move, and genetics. But what about the air we breathe every single day? Today's guest is building a platform around the powerful idea that your environment plays a major role in your health, and most people aren't even aware of it. We are joined by Eric Kloss. I hope I pronounced your name correctly.
Yes, you have.
Okay. He's the founder and CEO of Daily Breath, a platform designed to help people track symptoms, identify personal environmental triggers, and take action to improve their health. This is a conversation about the future of health, data, and how awareness can change everything. Eric, welcome to Thought Atlas. It's a pleasure to have you.
Thank you very much. I appreciate the opportunity to appear for the audience of Thought Atlas product podcast. Um, it's really a pleasure to talk about environmental health. As you indicated, it's kind of what we define as the invisible threat. And what we're
Yes,
trying to do is bring visibility to the issue and the topic. It's obviously something that people intersect with every day of their life. And it's not really accommodated for either in tracking their health or by the medical community in actually managing their care. So excited about the opportunity.
wow, awesome. Thank you so much for that, quick intro. Now, Eric, before we kick things off, yeah, on Thought Atlas, I and my listeners, we want to get to know more about our guests. Aside what you do, aside your expertise, your accolades, and your achievements, we want to get to know you more as a person. So, can you please tell us more about yourself? What's your favorite food? What's your best color? What are some of your hobbies?
Favorite food. Favorite food is beef stroganoff, and favorite color is blue. You'll
Oh,
see that in
wow.
the app. And hobby is I like golf. I like Texas Hold'em poker. um, a couple things like that. I also do, ironically, I do a podcast with my son on Washington Capitals ice hockey. So I'm a big fan of the Washington Capitals.
Wow.
And we do a weekly podcast on kind of the most recent games and tracking the players and their prospects and all that kind of stuff. So yeah, that's kind of a side project that I have with my son.
Wow. Awesome. Now, thank you so much for letting us to get to know you, Eric. And once again, it's a pleasure to have you on the podcast. Now, obviously, I want to ask you why air is important. Obviously, we all know that we need air to survive. We need to breathe to be able to live on this planet. But, we don't usually think of air as a health factor. So why is that so important?
Well, I mean, on average, we inhale 20 breaths a day, right? Inhale and outhale, exhale, inhale and exhale. And, I think in general, people um, manage their breathing, without even thinking about it, right? There is a
Yes,
lot of people who talk about rhythmic breathing and various things like that. But that's not really about what's actually in the air that you're breathing, right? And for whatever reason,
yes,
Aristotle noticed this literally, thousands and thousands of years. He observed, that there were certain things in the air and that we were breathing those things. And what is that
yes,
physiological impact? So he had already, as early as then, identified that probably there was a correlation between what is in the air you're breathing and how your body is physiologically responding to those various pollutants, allergens, dust. It might have been construction stuff when people were building things. It could have been a whole
yes,
range of issues, right? Um,
yes,
but you then introduced a built environment, like in the late 1900s. We started to, we had the Industrial Revolution. We started to build lots of things, right? Manufacture lots
yes,
of things and homes and stuff like that. And then obviously, cars, vehicles, all that kind of stuff. So, whether it's greenhouse gas emissions or, whether it's trap, which is traffic related air pollution. Those are things that were introduced. And then in our built environments, your indoor air quality is impacted by various chemicals that are in your because of things that are built in your home. And for example, if you got a sofa in the last 50 years, in order to make sure that it was fireproof, they put something called formaldehyde or flame
Yes.
retardant on the sofa. Well, those are chemicals, right? And so those chemicals interact with our indoor environment to create potential risk. And so there's
Wow.
lots of indoor and outdoor air pollutants that impact us. Now, outdoor air, a lot of people will talk about the various weather related impacts, right? So whether it's a wildfire that's as a result of heat and drought that causes
Yes.
wildfire smoke, or whether it's a precipitation event or a hurricane that creates water in your home that creates mold, right? And mold is very toxic as a pollutant or an
Yes.
allergen. So, these are all things that, really the science in the last 25 years has shown that there's a correlation between these environmental exposures and health. And we very loosely understand that. And quite frankly, we don't have a very robust ecosystem to track air quality and then correlate it directly with either acute symptoms or a deterioration of health, right? And
Yes.
so that's what I have discovered over the last 10 years as I've kind of ventured forward with what I describe as a technology solution. I've realized that there's many challenges in trying to address that particular issue.
Wow. Wow. Honestly, I've been thinking about this for a while, but not this in depth, not to this extent. And honestly, Eric, you've kind of like opened, should I say, kind of Pandora's box rather, to all of us. And this needs to be known, and we need to work on it now before it gets worse. Now, I want to ask you, you mentioned something called daily breath. What is daily breath in simple terms?
So, in simple terms, it's a mobile app that connects the exposures, your allergen and pollutant exposures, as they're impacted by weather conditions,
Yes.
connects that with your health impacts, personal health impacts. So one of the
Wow.
things you'll notice with air quality apps that are currently out in the market is that they will try to communicate what your exposure risk is. And what they don't factor in is, well, how have you experienced these exposures previously, right? So it's really a passive approach to telling you how severe the exposure is, but not really telling you anything about your individual sensitivity or your personal susceptibility to experiencing symptoms. And there's two types of symptoms that we track, hopefully. Is one is your acute symptoms. That's when you actually start to feel some level of respiratory difficulty. It might start with allergy symptoms. It might
Yes.
start with, you know, coughing, or, you could get the sniffles if it's an allergen, those types of things. But it ultimately starts to modify your airways. And what that means is it's affecting your airways in a manner that's going to potentially constrict your airways and therefore limit your capacity for breathing. And that's what ultimately leads to things called asthma attacks, right? Asthma
Yes.
exacerbations. They also occur in people who have COPD or chronic bronchitis, emphysema, things like that. So those are acute symptoms, and those are problematic because if a person doesn't breathe for 3 minutes, right, there's
Yeah.
serious implications, right?
Oh man.
So there are rescue inhalers or relief inhalers that people use or travel with so that in the event that something occurs, they're able to use this relief inhaler. And what that does is that opens up the airways and lets the person breathe more effectively. Okay. Um,
Yes.
and then within the industry, there's lots of other medications that people can receive to manage what I call their susceptibility to experiencing symptoms, right? Now, what I
Yes.
have tried to focus on is the idea is to correlate these two on a personal level so that you can begin to determine what allergens and pollutants are exactly problematic for you, right? Again,
Yes.
if we just broadcast information around air quality, you're seeing where bad things are going on and you're seeing how bad they are, but you're really not understanding, well, how do you experience things, right? And in some ways, it's
Yes.
kind of crazy that there's even a green for good air quality. Because the fact of the matter is, there's always allergens and pollutants in the air. So there's no such thing as clean air, right?
Oh my
100%
God.
clean air, right?
Oh
And
my God. Yeah.
it's almost a misnomer. In the United States, we did something called the Clean Air Act. This was in the 70s, right?
Yeah.
And what we
Yes.
did was we put certain standards in place and even created um, some solutions that allowed smokestacks to, quote, clean the air. Now, the problem with that was it was still spewing pollution out the smokestack. It just was making the smoke cleaner, right? So we
Yeah.
have this misconception that there's clean air out there, right? The reality is there is not clean air out there. The question is, how do we respond to the clean air, the air that we breathe every day? How do we manage it, right? And it's just not
Yes.
something. I was talking to somebody recently about the concept of nutrition, right? We know that nutrition and nutrition plans came out of the idea that there were foods that are bad for us to eat. And there are better foods that we could eat. And so what I
Yes.
was proposing to them was like, how do we get a similar concept for people when it comes to breathing air, right? That there needs to be a plan for you so that you can do your best to breathe cleaner air. And when I
Oh
say that,
wow.
it's like what my message has been is inhale less of the pollutants and allergens that are in the air you breathe. And what are those steps? Those can be an air purifier in your home. Those can be changing your HVAC filter in your home
Yes.
on a quarterly basis. um, there's various solutions out there that are beginning to emerge around, personal air purifier that you wear around your neck, called Respiray. There's
Yes.
allergen sprays out there where you spray. You spray this. It's a liquid, but what it does is it encapsulates the allergens, which are really small, but it drives
Yes.
them to the ground and makes and neutralizes them, right? So it makes them so that
Wow.
they're less problematic, so that you don't necessarily have an allergic response to those allergens. So all of these things are basically an idea behind saying we need to be more environmentally aware. We need to figure out environmental intelligence, personal environmental intelligence, and then we have to have that drive personal action. What are the things I can do to breathe cleaner air on a daily basis? And that's kind of the purpose behind Daily Breath, is really to connect those dots.
Wow. Wow. Thank you so much for that wonderful response and that clarification, Eric. Now, Eric, what is personalized environmental health risk index and how does it work?
Right. So the idea is that as a person actually records their symptoms, so it's a self-reported symptom.
Yes.
That's basically in the background capturing the allergens and pollutants and the weather conditions that uh, occur at the time of that symptom. It's actually also recording the location, and it's
Yes.
recording the time of day. Um, and then what we're doing is over time, we're applying machine learning against that to figure out, okay, now based on 10 of these recorded symptoms, I can begin to detect patterns and trends. And I notice that you have asthma attacks on days when the pollutants are high, but it's also on days specifically that there's hot temperatures and high humidity.
Yes.
So the app actually shows an impact summary. And so people might ask, well, why would that be? Okay. Well, hot
Yes.
temperatures and high humidity, the way allergens and pollutants act, and these are very small particulates in the air, right? But what
Yes.
happens in hot temperatures and high humidity is they adhere to each other. They become more dense. If they're more dense, then they're more easily inhaled into our airways. And because they're more easily inhaled, we might have an allergic response or an asthma
Reaction.
attack, right?
Yeah.
And so
Yes.
that's what we're trying to do is ultimately show the individuals personalized trends and translate that into a personalized risk index on a daily basis. And then also those thresholds allow us to deliver personalized alerts so that over time we'll be able to send an alert to this individual when okay the AQI happens to be over 85 and there's a specific threshold that that's when I have my asthma attacks. What I was
Yes.
saying earlier about the green, what if people are having asthma attacks when it's actually a green day? What does that tell you? Well, what that tells you is
Exactly.
what
Exactly.
whatever whatever threshold, you know, you reached on that day when you experience that asthma attack, that's a problematic threshold for you. So it's not
Yeah.
green, it's probably a yellow or a red, right? Um,
Yeah.
but that's kind of what we're trying to do over time is deliver this personalized information as opposed to having this more generalized information. And one of the things that's important in that, we're trying to gather more and more local information and that is a real challenge because most of our air quality data is based on satellite observational data. It's based
Yes.
on fixed networks that are widely distributed. And what we're looking at, I'm working with some partners right now on mobility based sensors. And so, what that is in an urban city, the sensors would be on the top of fleet vehicles like an Amazon truck or a postal service truck or something like that. And what they start to do is map on a daily basis air quality at a very local level, 1 meter level. The other air quality apps that I described that are using this satellite observational data and fixed
Yes.
network data are actually delivering air quality information at a 5 kilometer, 3.1 mile radius. So, where I am physically in my location, you're telling me that the same air quality that I am experiencing here in my location is the same as what it's reading 3.1 miles away, right? So the average
Definitely
person
not.
knows the average person knows that's probably not true, right?
Yeah.
And so
Yeah.
that's what's really challenging with the air quality apps. They're trying to inform risk, but it's really not personal, local risk, right? And so that's really the challenge with Daily Breath. But I wanted to bring this app to market and develop this platform because I saw that sensor technology was improving. I saw that digital health was coming available. I saw that big
Yes.
data and AI and machine learning were coming together. So I realized that there was a way to bring this personalized environmental mental health to individuals. And the biggest change that's really occurred in the last 5 years is that what we've learned is there's so much now more evidence that hey, it's not just that these pollutants and allergens are impacting asthma, COPD, cardiovascular health, but guess what? Everybody's being impacted by the poor air
Yes.
we breathe, right? And
Yes.
so whether
Yes.
it's our behavioral health, our mental health, um, whether it's pregnant women who are being their literal babies in utero are being impacted by the pollutants that they're
Yes.
inhaling. There's so many different things that we're beginning to learn about this intersection, and most of that is
Yeah.
based on research and science and studies. But now, with an app like Daily Breath, you can start to gather that evidence through the app and the platform.
Yes. Thank you so much for that wonderful response and that clarification, Eric. And to add to everything you've said, there's also the fact that, the impure air could contain, endocrine disruptors, which could lead to hormonal imbalance. That's also something we need to kind of like, watch out for. And also, I love the name you guys gave to that, that personalized way of testing, which is the Perry score, if I'm not mistaken.
That's
The
correct. That's correct.
Yeah.
Um, the idea is, and really we started with the daily breath risk index, but I think it's almost hard to communicate another number, right? And that's one of the
Yeah.
things that I'm learning is I'm trying to communicate air quality to people, right? So what
Yes.
when I started this process, there were a lot of ideas and concepts that I had, but over time, what I've learned is numbers are hard, right? And it's hard even
Yeah.
for people to understand what the air quality index is. And so, one of the things I'm going through right now is a lot of transformations in the app itself to move towards a map based approach, which is really people recording their symptoms on a map and then overlaying that with air quality indexes and pollutants again on these with this local data that I hope to obtain, so that people can actually begin to see on a map and at a snapshot how bad the air quality is. But then also based on the person's geolocation, in some ways geolocation is really the killer part of this equation, because if you begin to understand that people experience their symptoms most in a particular, let's say, yellow or red plume, right?
Yeah.
Then what you can start to do is set up alerts so that, let's say, your school that you're going to go to this morning is in a red zone. You can actually get an alert before you head off to school that says the air quality at your school is in a red zone, right? So those are the
Yeah.
kinds of powerful tools that we can begin to provide users, because we ultimately want to do two things. We want to change behavior, and we do that really by adjusting behaviors. I'm talking to a partner about creating what I call healthy routes, right? So you would be able to put out
Mm.
your starting point, put out your ending point, and let's say it was to a school, or you walk to work or whatever. You would be able to see within a city, oh, guess what? The pollution is worse on this particular road than the other road, and that could be for a whole range of reasons. Maybe it's a 4-lane highway, or maybe it's a road that specifically has a lot more truck traffic, right, than
Yes.
another street. So you could actually determine a different route that you're going to take that's more of a clean air route, right? So that's one
Yeah.
thing. And I think that that's what's really valuable here is that people respond to visuals. If you can give them visuals, so think of it in terms of
Yes.
like Waze,
Again,
right? The
you guys can
Waze
even
is
gamify it in a way.
the Waze is like a traffic app, right?
Yeah.
And I think of this as like a Waze for the environment, right?
Yes.
Knowing where things are bad, knowing how you respond to those things, and making sure you can take alternative paths, or even there's lots of recommendations in my app, right? It says, wear a mask today, or different things like that, or hey, we've noticed that your attacks are usually in the morning, so you might want to go outside later in the day. So that's what
Yes.
we're really trying to do, is provide users with ammunition so that they can really manage their day in relation to the air they breathe.
Wow. Wow. Thank you so much for that wonderful response and that clarification, Eric. And I even wanted to add, you guys can kind of like, gamify the app in a way that it's fun to use. Besides keeping yourself safe, you can also, you just, how do I put it? It's interesting to use the app because besides you're learning new things essentially and trying to understand your environment and how it affects your health, especially when it
Right.
comes to air quality. So I wanted to ask, why do you think the, traditional healthcare system as kind of like, should I say, overlooked environmental exposure when it comes to, health in general?
Right. Well, so what I've done a little bit of research recently, and I found out that only 20% of all the medical schools around the world have any type of curriculum, input, content, whatever you want to call it, that covers environmental health, right?
Wow.
So I think to a certain extent that exposes that within the medical training process, right, we're not really addressing this particular topic, right?
Yes.
And, in part, so think about it in terms of there was this human genome project for genetics, right?
Yes.
And
Yes.
it's taken literally 30, 40 years for the project to go on, for some of the findings to happen, and then for suddenly over time bleed that into potentially how people are handling healthcare, managing their healthcare. And that's
Yes.
really, even in that particular lane, it's somewhat haphazard, right? It depends really on the doctor you're seeing and those types of things. And in some cases, it's a consumer based, so I want to get a genetic test, right? Or something like that. But
Yes.
if you think of it in terms of, okay, the environment, well, there's something called the Human Exposome Project, and it was literally just initiated, I think, in the last couple of years. And the reason they did that, similar to the Human Genome Project, was okay, now what I will argue is it's not as definitive as your genes, right? Mapping the
Yeah.
genome was one thing, right? Unfortunately, exposures are, there's over 6,000 that they've documented so far. But
Wow.
the exposures are happening every day. We're learning more exposures. We're building things that might have different new exposures in them, all these kinds of things. But the purpose of the Human Exposome Project is really, again, to document what are these exposures, right? Now,
Yes.
on a personal level, when I look at it, I'm like, well, okay, that could take 20 years for them to, document the entire human exposome. What about the people that are having negative health impacts today, right? So that's
Yes.
what I've always said about Daily Breath is like, um, the reality is people need help today managing the air they breathe, right? And all of these initiatives are great, but they're not going to move the needle within the medical community.
Yes.
I ultimately I think it's patience. In some ways, that's why I kind of went. I targeted Daily Breath to consumers and patients directly, because it's almost like they need to be the ones who bring in. So, for example, one of the things I'm doing right now is developing some reports, right? And so, let's
Yes.
say you could bring in a monthly report and it would have 6 symptoms and it would show a trend line, so that, oh, temperature, humidity, PM 2.5, ozone. But you'd be able to, literally bring this into your doctor and say, hey, listen, this is what Daily Breath has told me, what I'm being exposed to. And then also what's interesting about that is it could potentially show them, hey, I happen to use my inhaler, this particular time, and it
Yes.
didn't work, and so is there a chance to basically review medication efficacy based on whether it was effective given a particular pollutant exposure and stuff like that? So I think it's almost as if, you have to introduce it into the community itself, and they become greater advocates for themselves in communicating those risks, to their doctor, so their doctor understands it. But I'm also working with potential partners that are actually trying to introduce these environmental data elements into EHRs, electronic health records, right? So that a doctor
Yes.
could potentially look at a patient's record and see, oh, today's exposure risk index is this.
Wow.
And hopefully, over time, that could be the Perry score, right? The daily breath risk index score,
Yes.
or the personalized risk index score. Perry would be up in the corner and say, this is what the score is, and this is what their pollutants are. And then, hypothetically, the idea would be the clinician could broadcast to a group of patients that happen to be in a
Yes.
particular area what the air quality risk is for that area, right? So there's various interfaces,
Yes.
but again, all of this is new, right? And so,
Yes.
to your point, we have to learn. We have to figure out what is the best way to support clinicians while we try to focus on supporting patients.
Wow. Wow. This seems like it's going to take a while to, to really understand and grasp. But I'm glad that, you've already started working on it and you're making progress and making progress fast. And that's what really matters. So
Yeah.
I wanted to ask you, how do you see technology shaping, personal health awareness in the future? I was thinking, I was just like brainstorming. I was thinking maybe a time could come where, your app could actually come with some kind of a contraption, maybe a device, if you will, that can actually, test for air quality, test for
Right.
yeah,
So,
kind
so
of
you,
yeah.
you, so I was mentioning the mobility play, and that's really about connecting to an API. All of those sensors are, traveling through a city, and once they have that data flowing in real time, I'm able to
Yes.
connect to that API and pull that information in. But one of the interesting things is there's wearable air quality monitors that are beginning to emerge that track a limited number of things. Temperature, humidity, PM 2.5, and ozone are the most common. But hopefully that technology is improving as well. And so
Yes.
that's on your person. That's a wearable, right? So
Wow.
what I'm talking to these partners about is they have a Bluetooth enabled device, air quality monitor, and I can connect to that device. So again, think of it in terms of trying to develop an app that, depending on what is the closest available source for an air quality measurement, I'll pull from that source, right? So, for example, one of my versions of the app has regular data. It's called, it's WeatherBit.io. It has air quality, weather, and pollen information. Okay. Now, again, as I said, that's 5 kilometer, 3.1 mile data, but that's the initial app. They download it, they start to use it. Maybe the next layer would be the Sparrow data, which is basically this 1 meter level data for cities that that they map out. Now, again, Sparrow is going to take time to deploy because they're going city by city, right?
Yes.
But that's the next layer. And then the last layer is maybe on the most personalized version of Daily Breath, you actually integrate that with these wearables that are available, right? And so
Yeah.
it can be different layers, and part of it would be um, maybe your own personal symptom map and your own personal data is associated with whatever the most local environmental data is, right?
Yeah.
So that's the key, is really connecting those types of technologies. Now, interestingly enough, the other thing that you kind of when you said technology, I'm thinking of is, imagine if over time, and one of the things I'm working on now is whether you're outdoors or indoors, I want to track your symptoms, right?
Well,
Because
yeah.
ultimately, I might be able to either connect to the wearable, or I might be able to connect to an indoor air quality monitor, right? So that I draw the indoor air quality measurements directly from that device, right? Um,
Yes.
so I can actually envision a world where you develop your Perry score, and based on your Perry score, the air purifier in your room, family room, your bedroom,
Wow.
whatever,
Wow. Well, I can already
recognize
yeah.
recognizes a threshold that's been met, and it turns the air purifier on or off, depending
Wow.
on thresholds that it's reaching. Okay,
That's
it's a
it's
di-
actually feasible.
it's a, well, it's a different concept than the concept of, okay, we run our air purifier all the time, right?
Yeah.
Well, and I think that that's part of the question. Is that feasible? Is it practical? Right? I mean, it's like, but again, that's what I'm saying is, I'm a voracious learner, and I think one of the things I've learned here is that I started 10 years ago. I was way ahead of my time. And
Yeah.
this, being successful doing this is going to require a lot of experimentation.
Yes.
And like I said earlier, there are things that I've done within the app that I've realized that, okay, wait a second, maybe this isn't the way the average person consumes this information. Maybe I have to change my concepts of how most effectively to communicate this. I'm part of a air quality communications network. It's global in nature,
Wow.
and that's one of the things I constantly talk to them about. Is, you're trying to figure out how to communicate air quality through art and science and all these different things, and like I have an app. I have an app where I'm trying to communicate
Yeah.
air quality to people, right? So
Yeah.
it's a fundamental part of my business to figure out the most effective way to do that. And ironically, in a for-profit company, in a way that people are willing to pay for it, right?
Yes.
And
Yes.
so even though I know it's critical information, I certainly want to provide it for free. You've got to figure out a way, to make money at it.
Yes.
And so that is part of the challenge, is figuring out, how do I deliver enough value that people recognize that this is important to them, and it's like they're willing to pay for these various levels that I hope to introduce over time. Right now, I have a 99-cent app. Right, it's
Yes.
free. Once you get in there, there's a couple features that if you click on them, it'll ask you to pay 99 cents. But there's other things that I'm adding now that will probably raise that price. And the question really will be, is it valuable enough for people to spend 2 quarters a month, 49 cents a month on,
Yes.
or, that kind of thing. So, you're constantly trying to figure out different ways of, communicating your value proposition, and then also obviously getting paid for your value proposition.
Yes. Thank you so much for that wonderful response, Eric. And first off, the part about, having someone to air purify, being able to automatically turn on or off, depending on the person's, Perry score. I think that's absolutely fabulous because it could actually help, save on electrical bills, on electricity bills and power, essentially. And yes, I agree with you for a fact. You're doing something amazing, trying to help people and make people understand that your environment, the air you breathe, actually plays a key role in how healthy you are. And definitely, you need to get paid for it. You understand? I mean, you say it yourself, you've been doing this for 10 years now, which is a lot of time, effort, and energy, and even money, your own personal money have been put into this. So definitely, it's a business, and I can actually see it on the profit side. I see it being profitable, and I see people actually, coming out to actually pay to use your app. And I know one day you're going to definitely get there. So I have a set of rapid fire questions I want to ask you. You can either
Okay.
answer with a phrase or a sentence. And I also want you to know that both options are available. If you feel you can't pick either of the options, you can pick both of them. So the first one is prevention or treatment.
So prevention. And and
Ah,
and
yes.
and again, there is aspects of the app where I'm trying to track. So I have automatic medication reminders in the app, so that
Wow.
if the user is taking an allergy medicine, or they're taking a controller medication, or even they're getting biologics, which is a shot periodically, or even allergen immunotherapy, which is taking allergy drops or allergy shots. All of
Yes.
those have medication reminders in them, right? And so what that's trying to do is, one of the interesting things is 50% of the people who've been prescribed controller medications don't take them every day. Okay. And this is not,
Wow.
sometimes you'll hear people say, well, I feel okay today. That's not the issue. This is a controller medication that you have to take because your airways are prone to being impacted by or inflamed by things that you experience when you go outdoors or indoors or whatever, right? So the idea
Yes.
is that you have a significant enough asthma problem or COPD problem that they have basically prescribed a daily medication that you're supposed to take, right? So
Yes.
50% of those people who are prescribed that don't take it every day, right? So the app is aimed at encouraging treatment that they've already been prescribed. But really, the primary motivation of the app is really to get them ahead of the game, right? My issue is,
Yeah.
why are people experiencing symptoms? In asthma and COPD, they are triggered. Symptoms are triggered. Well, then you have to ask, what are they triggered by? Right? They are triggered by allergens, pollutants. Um, they're allergic to their pet dander. They're cockroaches. I mean, there's a whole range of things, dust mites.
Yes.
There's dust, there's wildfire smoke, there's a whole range of things. And these are all triggers, right? So the issue for me has always been, okay, if symptoms get severe, they lead to asthma attacks, which lead to ER visits, which lead to hospital stays. And some of those asthma attacks are so severe, they result in serious implications. One of the
Yes.
inspirations for me when I brought this together in 2017, that was the first iteration of Daily Breath. One of the inspirations for me was a young girl in Iowa in the US, and or actually Nebraska, and she went to on Fourth of July weekend, went to Iowa to an amusement park weekend vacation, right, with the family.
Yeah.
She was 16 years old. She went to an amusement park. She was outside. Probably the air quality wasn't really good. There's also pesticides out, west, because of the farms and everything else.
Yes. Yes.
So she was exposed to all that stuff. But then she went home to a hotel that evening, and she went down to a hotel pool. And hotel pools historically have a lot of chlorine, and chlorine can be a real irritant for somebody who has asthma. She was down for 20 minutes. What that means, she stopped breathing. Okay. And so
Yes.
for 20
Oh
minutes,
my God.
she was not breathing. They obviously resuscitated her in some capacity on the way to the hospital. And she ended up being a paraplegic. Now, the
Oh
article
my
that
God.
stim yes, the article that stimulated my interest said doctors trying to pinpoint triggers of 16-year-old in the ICU. And so that just hit me like a bolt of lightning. Why are we pinpointing triggers after the fact? Why are we
Yeah.
not pinpointing triggers before symptoms occur and then providing that ammunition to people who are at risk, right? And so, I was very surprised about a month ago. I was looking up some information and I found that out that that particular individual had passed away
Oh
last
my.
year
Oh
at the
my.
age of 20, at the age of 24. And so here you have a family that was dramatically impacted by this incident. A girl's life was dramatically impacted. And again, you talk about premature mortality, right? I mean, this is a person who, you know, basically experienced what I describe as potentially preventable asthma attacks, right? And so that's the story I tend to graph to is, and I talk about helping one life, helping everyone breathe easier, one life at one symptom at a time.
Yeah.
But it's really my thing has always been if even one life breathes easier because daily breath has been available, then that's what I define as success.
Wow. Wow. Honestly, I am so when you explain what happened to that young girl, it's just so sad, my. All because of,
Yes.
something that we weren't able to understand early. But like I said before, I'm actually quite glad that, there are people like yourself out there trying to actually decipher and understand this to actually help people, which is absolutely amazing. Now, if someone is listening and they've never thought about how their environment affects their health, what is the first step they should take to become more aware?
Well, I'd encourage them to download Daily Breath.
Yeah,
I
definitely.
think obviously that's the first step from my perspective is I think the app is a work in progress. When I
Yeah,
started the process, I basically decided don't let the perfect be the enemy of the good. And so what you do is you bring to market the best opportunity you have, and then you improve it over time. And so what I'm trying to do right now is get people to download the app, use the app, certainly pay for the app, the paid
yes,
version. And like all apps, you're looking for as much feedback from users as possible so that you can actually improve it to meet the needs of those people who are most particularly at risk, right? I want it to meet everybody's need over time, but certainly the people who have asthma and COPD and some of the more at-risk populations, we're trying to figure out, how to handle that. And one example of that is children with asthma. One of the things that's on my roadmap is creating a family plan, right? So the mother of
Yes.
an asthmatic child, she could basically set up an account and then have multiple profiles. Say she has two kids with asthma, right? She would probably
Yes.
want to track the air quality for both of those children. And at some point the children get over 15, 16, I don't know what that age is, but then they can manage their own account. But certainly parents are the people who actually most likely are managing their child's asthma. And so we're trying to empower them as well, right? I mean, again, if you think of the anecdote around the 16-year-old, if the parent had the Daily Breath app, would they have known a little
Yes.
bit more about the pollutants that were in the air that day? And would that
Yes.
have empowered them, to either, have, the young girl with, to have to have a inhaler with her, or use the inhaler that day, or essentially maybe before they even went to the hotel pool, use the inhaler, because again, you're trying to inoculate yourself from having that airway inflammation. And so,
Yes.
we don't know what the steps are that that person could take that would potentially have prevented that event from occurring. But that's really what we're trying to do, is focus on that.
Wow. Thank you so much for that wonderful response. And thank you once again for the beautiful work you're doing. Honestly, Eric, this
Thank,
has been a fascinating conversation about a side of health that most people don't pay attention to. Now, where can my listeners, learn more about your work, connect with you, download your app, and do you have any other material you may want my listeners to, come and check out?
So yeah, the primary source for information about Daily Breath is the website www.dailybreath.com, and in particular, there's a link there called Company, which provides a lot of rich content around what I've been doing for the last 10 years. I like to say that I've spent 10,000 hours in environmental health, which kind of makes me somewhat of an expert, even though I'm not a scientist, right?
Yeah, yeah.
But that's certainly one place they can go. And then again, in the App Store, the Apple App Store, and in Google Play, the app is called Daily Breath Dash the Air You Breathe. And so they can certainly download the app there. But I really do appreciate the opportunity to appear on the podcast, and I hope the listeners really, appreciate kind of some of the information, and I hope they'll start taking action every day, to clean the air they breathe. Because again, we're not at the mercy of the weather and the environment. We can take action and prevent negative health impacts from occurring.
Yes, and I totally agree with you for a fact, Eric. And Eric, once again, thank you for the beautiful work you're doing. Thank you for coming on my podcast and sharing your expertise, sharing the beautiful work you've done so far, and sharing how you're going to do amazing things in the future to actually help people and, save more people that may have similar condition to that girl that unfortunately she wasn't fortunate enough to have what you're currently creating. Once again, thank you so much. Do have a wonderful day and you take care of yourself.
Okay, terrific. Thank you very much.
All right. Bye bye. Take care.
Take care.